Good evening, everyone. Let us continue our discussion on the topics connected with your paper on women's health issues and concepts. So, we have been discussing so far various topics which is related with this broad theme of women's health. And you might be thinking every day I revise what topics we have done. Probably for the people who are joining today, it will be helpful. And that is why I repeat. So, for those who have been attending the classes from day one, it can be a kind of revision. And those who are attending for the first day, they will also come to know that what topic am I discussing. So, till yesterday, we discussed about Unit 10. Till yesterday, we completed our 10th unit, and it has multiple topics like health status parameters, concept of nutrition and balanced diet, nutrients in food, what is the dietary requirements in different age groups, common nutritional problems, then nutrition programs for women and children, and then, how is the anatomy and physiology of the reproduction and the common gynecological problems which women suffer and face? We also had a discussion on what can be the various pregnancy related problems. Then, in Unit 9, we tried to understand about what are the various birth control methods, right from your condom, your pills, to injections, to spermicidals, and natural methods also. And most important method, like once childbirth has been completed and the couple or partners do not want any more children, then there is a process of permanent sterilization, after which the childbirth completely stops. And then we also touched upon the other health problems which women suffer. Yesterday, we were trying to again discuss about challenges connected with her menopause, like menstrual cycle, during pregnancy, reproductive health issues. And very, very important, we also touched upon back pain. Of course, back pain can happen to anyone, but we have also discussed it how due to various factors, the challenge of back pain among women becomes more severe. And then we started discussing a very, very important topic on environment, women, and health. So, in our syllabus, there are two lessons which is going to talk about rural environment and women's health and urban environment and women's health. So, let me share the screen and then we take our discussion ahead. So, yesterday's class, I initiated this discussion where we were trying to understand that how various environmental factors can influence women's health. So, we discussed this and how environmental pollution is going to discuss. As I mentioned in yesterday's class itself, that broadly we will discuss. One second, please, one second. I'm sorry for this disturbance. So, we were discussing that how, yesterday's class, I'm just quickly revising so that you will be able to relate which topic are we discussing. So, broadly, we try to understand that how women's health can be impacted by the environmental factors. So, in that connection, we had a very bird's eye view discussion on how environmental pollution can impact women's health, exposure to any kind of chemicals while working on the fields, like in terms of pesticides, herbicides, household chemicals, and climate change is one of the uh, very, very serious concerns which is going to impact women in a greater way. Of course, climate change impact is felt by everyone, but women becomes more, what can we say, more serious victims of climate change because women is the primary caretaker of the family And when multiple issues connected with natural resources are under stress and strain, then naturally women become more stressful in managing the household affairs. And how this climate change is going to impact the food security issues is also matter of concern. And we discussed this, and how occupational health, if you are into particular occupation, every occupation has got its relative risks, relative advantages. There are also limitations connected with every occupation. So, how this occupational health can impact women, that also we touched upon. Then I also broadly said that how resource management and agricultural practices can be very, very important. See, when we are talking about women health and environment, it also becomes important for us to understand that how women can take the lead to not only address the challenges of environment, but also she can be a very important she can play a very important role in decision making levels also. And that is why, with regard to resource management, because as I mentioned, women is a natural caretaker of the family. So she has a better hold on the resources at family level. And even yesterday, I was also talking about ecofeminism and how women can be very, very important in advocacy and leadership, and how education and awareness can go a long way in addressing this. So this is where I did till yesterday, and I started with this particular slide also. This is a slide I stopped in yesterday's class. Now, when we are talking about gender specific, again, the impact of environment can be on women, reproductive health also, mental health also, and also nutritional health to a great extent. Now, friends, when we are talking about environment here, we like for a broader discussion, I mean to say, for broader discussion, we can talk not only about natural environment, but we can also talk about the social environment. We can also talk about the political and cultural environment. So just to give you a simple example here, so that we can have more broad-based discussion on this topic and just not confine ourselves to natural environment. One simple example, like you all are familiar that almost it is 3 years war between Russia and Ukraine is going on. There are stress and strain and a war situation again between Palestine and Israel, which is going on. And these are officially declared full-fledged war levels kind of a situation. Apart from this, armed conflict is happening in almost major parts of the world. In fact, if you review the literature connected with it, you will come to know. So, in this kind of environment, also women are worst hit. And in this kind of environment, reproductive health of women is worst hit. Imagine in a war kind of a situation, she has to take care not only of her family, uh, because all resources are exhausted. What is happening to her reproductive health? What is happening to her if she is having a menstrual cycle? What is happening to her if she is pregnant? Where does she go for regular checkups? And in case if she has to deliver the child, which is the safe environment to deliver the child? And fortunately, with support, she could deliver the child, and safety of her just born baby and her own health becomes very, very important. So, environment, if you talk in terms of political environment or social environment, even this becomes very, very important. Now, if I talk about cultural environment, if there is a culture of domestic violence, patriarchy, of course, is there. Societies all over the world mostly are patriarchal in nature. That is changing. I'm not saying that we are still in that patriarchal structure format. That is changing, but again, you will definitely agree with me that concerns of domestic violence is real. It is just not hypothetical, and it is just not on paper. And I also agree that there is domestic violence against men. I'm not being partial only to women. But what is very important for us to understand is, like, let us say if there is constant domestic violence against women in terms of physical abuses, mental abuses, then imagine what kind of impact all those things will have. That family environment, how will that hit the woman? That also is matter of concern and discussion. Now, here the points, like if we are trying to understand in terms of natural environment, okay? So in terms of natural environment, you all are aware that challenges connected with fertility, and if we are consuming the fruits, vegetables with high level of pesticides and insecticides, that is playing real havoc with the menstrual cycle of the women because of the hormonal changes which has been created because of these pesticides and insecticides. In fact, if you go to physicians, you go to gynecologists, you will find many such cases. And then maternal health, what is happening to maternal health as a mother, or taking care also when she is pregnant or when she has a just born baby. So how air quality, water quality, whatever she is consuming, what kind of air is she breathing, what kind of quality of water is she consuming, that will impact not only her health but also the baby's health. Mental health, stress and anxiety. Stress and anxiety are the biggest killers. We were all scared of COVID, right? The entire world was in lockdown state. Entire global economy went for a six. The kind of stress what the entire world underwent during COVID period is, of course, it is beyond comparison. But what is very important for us to remember is stress and anxiety can be equally, killing factors. Probably they act in the pattern of slow poisoning to the human body with stress and anxiety. So, environmental degradation and climate change can lead to increased stress and anxiety, particularly for women who are more vulnerable due to social and economic factors. Friends, I was talking about ecofeminism, right? So, ecofeminism is that branch where you are trying to completely elaborate, expand, and explore the relationship between environment and women. Okay, so women can not only be the largest stakeholders to protect the environment, they can also be victims if environmental degradation is taking place. They are worst hit, worst hit. And then community displacement also, I was referring in yesterday's class, that if displacement is taking place, how it impacts women health. In fact, a very well-known World Bank economist, Michael Cernia, okay, he has done a very good work on the impact of development, and I was referring about development-induced displacement in yesterday's class. So, how displacement is leading to homelessness, foodlessness, marginalization. There is no livelihood opportunities. All your support network is lost because of displacement. And when you are being displaced from your tribal land, okay, or remote villages, probably you have the places of your ancestors also, religious places also, because people living in tribal communities, people living in villages, they are so emotionally connected with their really places of worship, right? So displacement impacts all these things. So the tremendous socio-economic, psychological impact of displacement can also drastically hit women. Nutritional health, so because of the environmental changes, uh, food security challenges are there. It can lead to malnutrition, and especially women who are pregnant and lactating, they are also worst hit at this time. So a part of this slide I had discussed yesterday, but I was not feeling fully satisfied with my discussion because the time was running away. So those who attended yesterday's class, please do not think that this is a repetition, please take it as a revision. And those who are coming to the class for the first day today, of course, you are welcome. Now, uh, here in this particular slide, we are trying to understand that environmental factors, this point I just mentioned, environmental factors impact women's health, and women can be the most important stakeholder in saving the environment. In fact, in India itself, you have hundreds and thousands of such examples. The most important example I would like to give you of Chipko movement. So Chipko movement, though, was initiated by Sundarlal Bahuguna, but in that, most of the people who were participating in that movement by, hugging the tree and not letting the people cut down the trees, most of them were women. In fact, if you talk also, though this is not straight away environmental movement, you talk about our own Telangana also, anti-Iraq movement. So, anti-Iraq movement was again led by women. You all are familiar with that. So, women can definitely play a very, very significant role in not only preserving the environment, natural environment, but also your social environment in terms of family. Now, see, when I talk about anti-Iraq movement, it was definitely a social movement, women-related social movement, basically because when husbands would all the time consume alcohol, okay, and whatever the family earnings were there that was being taken away for consuming alcohol, then you can imagine its overall impact on the family, right? So what we have to remember, basically what I'm trying to communicate is women can be very, very significant in the decision making leadership roles. So, addressing that is why, see, we are using this word gender sensitive approach. All right. So, gender sensitive approach in environmental policies, health interventions, and also acknowledging and understanding the areas where women can be vulnerable. See, friends, uh, man and women, they have been created separately by nature. They both have their respective strengths and weaknesses. Of course, this is not the point of our discussion right now, but I'm just trying to communicate one thing that man and women, they complement each other, right? So there should be no question of competition between a man and a woman that I am superior, you are inferior, or you are superior, I am inferior. Such kind of competitiveness is not the right approach. What is very important, whether it is health policies. Now, for example, you have family planning scheme, you have population control scheme, you have, like schemes connected with reproductive health or nutritional programs connected with women. Until and unless the vulnerability of women is not understood, not appreciated, and not recognized in the policy making, all the policies are likely to fail. That is why we are saying that whenever you are talking about women health and environment, whether rural area, urban area, tribal area, India, globally, Africa, America, whichever part you are talking, gender sensitive approaches will yield better result where you are not only appreciating the vulnerability of women, but you are also appreciating her strengths, which can be used to ensure that policy interventions become successful. So, gender sensitive approach, this is the key word in this entire slide. And if you want to have a gender sensitive approach, of course, it is important that you empower women through education, resources, leadership opportunities. And when you're doing all these things, you are in a better position to improve and promote environmental stewardship. So you are making woman, you're giving her that role. And of course, on this also there are some critiques that, okay, you want to overburden women with everything. So there are also critics connected with it. See, in Hindi there is a beautiful song, कुछ तो लोग कहेंगे, लोगों का काम है कहना. So if you are empowering women, it has XYZ connotations. If you are not empowering women, you have XYZ connotations. But any day, any time, no one can deny the fact that empowered women, it leads to empowered family, and empowered family leads to empowered society. I think no one can deny this equation. And usually, when we talk about women, the boys in our class, like when you are teaching a co-ed class, then the boys feel, okay, ma'am, everything is only for women and girls, nothing for boys and men. I'm not like, we are not trying to be partial, we are only trying to empower that category, probably, which due to various historical reasons, patriarchal reasons, have not attained that particular stature what she was supposed to attain. So again, this is not being partial here. Now let us, so far we were trying to understand in broad terms. Now let us exclusively focus that how rural environment and women's health is connected, and then we will also talk about how urban environment and women's health is connected. Of course, it will be in the context of the discussion what we had so far. Now, when we are talking about rural environment, you all are familiar that, especially when you talk about country like India, almost all 69% of Indian population lives in villages. And when you talk about rural women in particular, their social uh, placement in the society, you all are aware that in all the situation, women might not be in an empowered state of mind. But still, whether she's empowered or she's not empowered, what becomes matter of concern is she is expected to take the responsibility for everything, right? I think you will agree with me. Unfortunately, we do not have a direct interaction. Otherwise, class would have been more interesting. Even I would have an opportunity to directly listen to your opinion. Somehow, that opportunity is curtailed by our host. So, what is very important is she has to take the responsibility. Now, here, what kind of natural environment is prevailing in villages, in rural areas? What kind of socio-economic, cultural, and psychological environment prevailing in villages? All these things influence women's health directly and indirectly. Let me give you one or two examples and then we will proceed with our discussion. Now, let us say there is a newlywed couple, all right. Though today lot of awareness has come, people are aware that okay, you're not with regard to age of marriage and a lot of awareness is there, but still, let us say a young couple is there. The entire responsibility of having the children is vested on the wife. So probably the day uh, she's getting married, the newlywed couple is entering the house after the marriage. Probably the elders in the family, especially the elderly women in the family, they will, the first thing what they will say is, the today's the day of marriage. The first thing what will they say is, when are you going to give us good news? Right? So it means what? The social structuration is such that even the entire onus of having the child is rested on the woman. Second thing, which is very, very critical thing is, now here also I will definitely say scenario is undergoing lot of change. In fact, Even if the first child is a girl child, there is growing acceptance. There's definitely a lot of change. Even in villages, there is a lot of change. But I think you will also agree with me that still that mindset prevails. So if the first child is a girl, second child is a girl, who is held responsible? The woman. But you all are learned people. You all know about X chromosome, Y chromosome, and you know that who has XX, who has XY. I will not go beyond this discussion because that is outside the jurisdiction of this. But see, this social expectation and responsibility, which is inherent part of the socio-cultural and psychological environment of rural settings, have to be understood. Now, apart from this socio-cultural aspect, right, what is directly impacting women's health is the geographical conditions, the natural conditions which is there in village. Now, you might get a thought in your mind that how is land degradation, drought, migration of men, decrease in land productivity, how it is connected with women, that one natural question will come to your mind. So, the simple answer to this is whenever there is land degradation, it will have its impact on agriculture, drought like conditions will be created, and most of the times men migrate to nearby urban areas or township areas for earning because agriculture is no more serving the purpose. And in such kind of a scenario, all the burden connected with, of course, the husband is going to send the money, but the remaining entire burden of looking after whatever the existing field is there or family is there, the entire responsibility comes on women. When there is decrease in land productivity, see, these challenges are all, this is where we were discussing. I will take you to that slide. So, with regard to the first point, when I'm saying in terms of climate change, so extreme weather conditions, you can see extreme weather conditions, it will have physical, mental health issues on women and more vulnerability, food security challenges will come. So even if there is a land degradation issue, its environmental impact is on women. Natural disasters, if there is drought, there is famine, there is storm, there is floods. Again, women, she being the primary caretaker, the impact is more. Imagine if she is carrying at that time. You might have seen, like, I think last year or probably 2 years back, most probably last year itself, you might have seen reports that in our Jammu Kashmir, Himachal region, there was severe snowfall. Like it broke all records. And the women who were, pregnant and probably one or two women who were in remote areas, and because of heavy snowfall, there was no scope for the woman to reach out to the health center for her delivery. So, how armed forces people, Indian Army personnel, they facilitated, they responded to that SOS, and they made sure that women reaches the hospital on time, and she had a safe delivery. So, natural disasters in terms of floods, in terms of storms, in terms of avalanches, right? All this also impact women. Deforestation. The deforestation again. See why I'm emphasizing so much on ecofeminism, because any impact on natural resources, women are hit more seriously because women, she has to do the cooking part, and of course some places Ujjwala, because of Ujjwala Yojana and other schemes, the gas cylinder has reached. But the places where women is again dependent on firewood, wood fuel, to do the cooking. So if there is massive scale deforestation, she might not even get hold of the wood fuel to do the cooking. And if she is doing Cooking using the wood fuel, then kitchen smoke can also be a serious health hazard to Earth. Then loss of biodiversity, new emergence of diseases. Friends, climate change is impacting our biodiversity to a massive scale. And because this is getting impacted in such a way, new kind of health challenges, new kind of vector-borne diseases are also being witnessed. Then water and health. See, scarcity of water or water pollution again, its impact is there on women. Irrigation and dams, if they are being constructed, there is displacement. Just now we discussed how displacement can impact women. Pesticides and fertilizer use is definitely exposing women to a lot of chemicals, and that will also impact her reproductive health. Then the answer to all these above points lies in this point. Why we are discussing about women in particular? Because women are worst affected in their role as providers of basic needs. Then they are also users of natural resources, and they become the main victim if there is destruction of the local environment which is taking place. So I hope, friends, I'm making myself clear. And then some more important points in this connection. Let us quickly discuss. So, according to research, this research was published in Financial Times in December 2023. The details of the research was not given in the newspaper. I'm sure if we search it, we will get it. 50% of maternal deaths, and see the age 15 to 29 years in rural India due to pregnancy complications in childbirth. The whole concept of pregnancy and having a newborn is to be full of happiness and not scary. But if there is a death, either of mother or either of the child, now here we are talking about maternal deaths. Another research has proved that number of prior stillbirths was found to be more in deceased mothers. Our ignorant behavior and lack of services are harming the future. See, uh, this point I have not included to say that the situation is really bad. Lot of efforts are being done. Believe me, uh, I always tell that, criticizing the government is our most favorite time pass. We are very irresponsible and without much thought. We hold responsible for anything and everything. We hold government responsible, and we completely tend to forget that what is our responsibility as a citizen. Believe me, lot of effort is going on, but because of the diversity and expansive area of our country and such huge population, there will be gaps. There are gaps. And of course, all efforts are being done by respective state governments and the central government to fulfill those gaps. So, but in this, it also becomes important that we as community also take up. So, stillbirths is also one of the challenge. Dearth of resources and skilled healthcare staff has been a major problem. So, when we try to understand why this 50% of maternal deaths are taking place, probably one of the reasons is the person or the midwife who is facilitating the pregnancy is not skilled enough to, facilitate the process of childbirth. In fact, sometimes don't we read in our newspapers that because the concerned doctor was not there in the primary health center, the compounder facilitated the childbirth, leading to the death of the mother and child. This news was there in newspaper just a couple of days back. Super specialty maternity hospitals are mainly located in urban areas, and it is not feasible. In fact, not only feasible and not even accessible financially, right? Now, even if it is feasible, the time has its limitations. Over the years, doctors have witnessed many cases where mothers have either lost their lives or faced severe complications because of not reaching the hospital in time. So it is just not about hospital, my dear friends. It is also about the transportation to hospital. In this also, we have very good ambulance services are there who are working day in day out to reach out to the remote villages also, so we should definitely have a word of appreciation for them. Now, when we discuss about urban environment and women's health, because see, rural environment, geographical, natural, social, culture environment is different when compared to urban areas. So in because the pace of urbanization, the speed of urbanization is very very high. So when the pace of urbanization increases, what happens is rural to urban migration increases. So when this rural to urban migration is increasing, then there is tremendous pressure on the local government hospitals. And that is why, because of massive urbanization, see, whenever urbanization is uncontrolled, it will have its impact in terms of overcrowding, more and more of slums, the ecological conditions, environmental conditions, socio-economic conditions in slums is very, very unhygienic. There are water issues, hygiene issues, proper drainage facilities will not be there, waste management might not be appropriate. So when massive urbanization is taking place, it has its own set of challenges. These challenges will also impact the women. Now, imagine women who is living in slum. Imagine her health conditions. Imagine her socio-economic conditions. So, households headed by women frequently suffer disproportionate. I'm sorry, disproportionately in cities in the developing world. In fact, global urban poverty. Now, you might have heard about poverty, but again, we segregate between rural poverty and urban poverty. So, in fact, global urban poverty has become highly feminized. Now, you might be thinking, is poverty also male and female? So, my dear friends, there is a concept called as feminization of poverty. I request you to do further reading on that to understand that how poverty also hits women more badly when compared to men. Highly feminized because poor urban women tend to have low paying jobs, high illiteracy rates, and fewer years of formal education. So this is playing the main culprit in feminization of poverty. And they are also more vulnerable to partner violence, domestic violence, sexual violence can be more higher, and they have to take care of not only the family but also work as domestic help or in informal sector. And social and political factors also make it more difficult for women to take loans, and this will have its own impact. So, just to list out so that you have a better retention of the points what we are discussing: water pollution, human and industrial waste, and chemical pollutants, especially if the slum is close to industrial area, all the industrial emissions is also impacting women very badly. The toxic metals, and pesticides, insecticides, air pollution, of course, vehicular and domestic pollution. Many times, indoor air can be more polluting. You remember during COVID period also, sometimes advisories were issued that you, especially in the morning, try to open all your windows and let sunlight enter your house and let the indoor polluted air have an exit. And there are also many news channels which were trying to tell us that We should have certain indoor plants, including money plant, okay, which will help us to fight the indoor air pollution. So let us not be under the impression that, okay, I have a AC house and everything, I have exhaust fans, so there is no pollution, air pollution inside my house. Let us not be under that drama, that delusion, okay? And then noise pollution, overcrowding, slums, waste management, occupational hazards. I've just listed out these for you to have a better understanding. Then, even in urban women, see, when unchecked rural to urban migration is taking place, the health infrastructure in urban areas also gets badly hit. And that is why skilled care at birth and emergency care for urban women is again a challenge. Women who live in slums. Now, when the pace of urbanization is massive, okay, and the available land is less, pace of urbanization is massive, and if proper governance and proper urban policies are not there, not being implemented appropriately, then health infrastructure is badly hit, and there will be massive expansion of slums also. So these women and their newborns are particularly disadvantaged because they do not receive appropriate care during pregnancy and childbirth. This is very true with regard to women who are living in slums. Most cesarean sections in developing countries are performed among the urban richer and richest women, while often almost none of the urban poorest women have access to this life-saving procedure. See, when we were discussing about the complications during pregnancy, we did mention that if, like, suddenly the fluid in the mother's womb has reduced or has started leaking, and probably immediate cesarean is required. So government hospitals are also so much overburdened. So efforts are being made, but again, those gaps are definitely there. A similar trend can be seen regarding access to skilled birth attendants. Only very few of the poorest women have access to a doctor or a skilled nurse or midwife during the childbirth. Then HIV/AIDS, you're familiar. See, it's not that HIV/AIDS is there only in village, only in cities. It is there everywhere. But again, women in slum areas, women in uh, very living in very challenging housing conditions, they become more prone to this challenge. And according to statistics also, the trend, what trend is showing is generally higher in urban areas. Population-based household surveys indicate that prevalence is 1.7 times higher in urban areas than rural areas. And in concentrated epidemics groups at higher risk of HIV, owing to particular behaviors such as IV drug use, men having sex with men, or sex workers and their partners tend to cluster in urban areas, increasing potential for exposure in urban areas. So, urban areas uh, tend to show the trend of greater instances of HIV/AIDS, and again, women are also hit in this. Although they may represent greater risks of HIV exposure, urban areas also tend to benefit from greater access to healthcare service. So it is both ways. Like if there is a challenge, there is also a remedy associated with it. And the concentration of populations around health services underscores the potential for expanding and improving urban health services around HIV treatment and prevention. So now see, imagine again in urban areas, if women is educated, middle class, upper middle class, her position is relatively better when compared to women who live in slum areas because she might not be formally literate, not much educated, her awareness levels might not be very high. Though, see, like Ministry of Health and Family Welfare through ASHA workers and even the community health workers, they try to spread awareness in low income group areas as well. It's not that nothing is happening here. Those efforts are being made, but as I mentioned, gaps are there. So now let me, this image, while I was preparing for our lesson, I found this image in one of the articles. I'm sorry, I have not mentioned the credentials from where I have taken. I will try to share it in tomorrow's class. Now, this particular image might not be directly connected with our topic, but it will help us to understand that what factors play an important role in the presence of women in urban spaces. Okay, so these factors, this environment, only if it is supportive, it will help the presence of women. So, in terms of personal factors and environmental factors. And see, if you go through all these points, all these bullets or the phrases what is given on this slide, you will definitely be convinced that all these factors are inherently, directly or indirectly, they influence the physical health and mental health of urban dwellers overall and, of course, women also. So, in personal factors, we are talking about interpersonal and intrapersonal factors. So, in interpersonal factors, we are trying to understand how are the social networks. If the social network is supportive, norms are flexible, there is strong, good ethical standards, okay, then women's presence in urban spaces is better. Uh, See, my intention is not to show down any culture, but I'm sure you might have seen the images in countries like Afghanistan and all during Taliban period. And again, there was elected government, and again now Taliban has taken over Afghanistan. So, see there, again, when you talk about interpersonal factors, that culture is not an open culture. So the way women's presence in uh, public spaces is restricted because of various social factors. Social environment might not support women's presence much in urban spaces. Then intrapersonal factors include your psychological and demographic factors like gender, age, and then what ethnic group and how much is the well-being of the woman. So if women is like constant, like elderly women, their presence in urban spaces might be limited. Environmental factors is again, it talks about social environment. So how much is the sociability? How frequently women is going out? What is the comfort level? Are walking spaces available or not? Is 24-hour activity there or not? That is why I see metro cities, if you see, you will find women also moving around in the late nights because many working women who are working in call centers and because now entire service industry, a major component of service industry works in shifts. So all the women employees who are there, they are working in shifts and their movement can be in daytime, nighttime. So 24 activity movement is also there. Then livability, how attractive are the spaces also? Are they easily accessible? Are they secured or not? For women, security can be a very, very important factor and public oversight. So broadly, these are the factors. Now, since we have some more time left, I have picked up one interview. This interview is about, if you, I wanted to read out some important components from this interview. I will just see if I can share this particular screen. If I'm able to share this particular screen, I will try to do this. Now let me share this interview screen. I hope I'm able to do it. Yeah, right. So now that the screen is available, don't worry, I'm not going to read the entire interview, but I found this interview very important for us to get an information from a person who is working at a grassroots level. So, my dear friends, see, the topic is what you need to know about women's health in rural India. And this is an interview I will tell you, whose interview is this? Dr. Jyoti, who is head of gynecology and obstetrics department of RDT, Batalapalli Hospital. I think this is in Anantapur. So see, just one or two questions because the time limitation is there. This will help us to understand because see, we are not on the field. You are not on the field. I'm not there on the field. Dr. Jyoti is on the field. Her interview will help us to understand that what are the real issues. So the question is, what is the ground situation of women's sexual reproductive health in Anantapur? Do women have issues? Are they severe? This is a question. I just want to read out a response for all of you. Women are taught and expected to suffer in silence. See, what a powerful, I'm sorry, you might think that why I'm using that this is a powerful statement. I'm using the word powerful in the context that whatever she has said, that actually is powerful enough to hit our minds here, right? I think you will agree with me. So, women are taught and expected to suffer in silence, especially rural women are. If she is able to do that, she is considered a high value woman in society. Hence, issues related to their health are always neglected, never spoken about. Some of our classmates who are from rural areas, and if you are pursuing this particular course from districts or from villages, I'm sure you will be able to relate. You might not be suffering with this, but I'm sure these are the concerns in villages. It is worse than cities. Here in Anantapur, she's talking exclusively about Anantapur. Many women have high risk pregnancies, which is a result of ignoring nutrition intake, and subtle signs of complications. Anemia and urinary tract infections, we discussed this in previous classes, are pretty much rampant among women here. However, they often avoid getting it treated and end up increasing their complications. Women are reluctant to go to faraway places for checkup, even for severe problems. So, see, friends, this response is a clear picture which is trying to tell that, probably social factors are contributing a lot because, even today, socially, we expect that, women is doing all the household work and she's not openly talking about her health concerns. This is changing, of course, this is changing, but more change is required. There is one more question which I thought I wanted to read for all of you. Let me just check. Mm. Now, see, she's definitely presenting a positive picture that 10 years, a question was asked to her whether how much is the awareness? In terms of awareness, what is the situation? 10 years ago, women had no awareness at all in rural areas. As I mentioned, women are not expected to share their problems. So now, when they visit us, we try to make them talk. So, see, doctors can play, especially a gynecologist. Gynecologist can be a mother, she can be a friend, she can be a sister, she can be she can be a counselor, she can be a mentor, she can be a psychologist, providing all kinds of emotional support. So, asking the pregnant women who come for checkup to talk to let them express what exactly they are facing. The government is focusing on awareness campaign, and I must say that ASHA workers are doing a great job. See, in rural health setup, yeah, I was also talking when we were talking about midday meals and Poshan Abhiyan. I hope you remember. So ASHA workers, I think I will not be wrong if I say that ASHA workers actually are the backbone of not only rural health system but also the child care system exclusive. So ASHA workers, they play a very, very important role in providing awareness, providing the motivation, providing that all the information for the checkups and in all such child and women nutrition programs, ASHA workers, they are the key people. So ASHA workers are doing great job. In my opinion, there is an increase of 50% in terms of awareness. So see, this is what I was trying to tell you. There are problems, right? But lot of government efforts are going on. Awareness is also spreading. But we have come miles and we have miles to go. We need not be, disheartened that nothing is happening, everything is bad. No, that is a very negative attitude. And we should never have an attitude of, always cribbing on the government, because if you are cribbing on the government, you first see that whether I have fulfilled my responsibility as a citizen or not. That is extremely important. And so this is this. I felt when I read this interview, I felt this 50% awareness. I felt very motivating, and I thought I should share with all of you. There is one more piece I just will share with all of you, and yeah. See, she was also asked that what steps can be taken. So there are two ways that has to be proven. Especially she is talking with reference to Anantapur. First is to bank on sanghams, to strengthen them in a way where women not only pool their savings, discuss their daily course, but also talk about their health. She's talking about self-help groups. I believe giving training at community level to selected women representatives of sanghams, that is self-help groups, can be very helpful. So when Sangam meets every month, they discuss about their health. And second, what is she saying? Develop effective communication skills. Because when you are communicating about the schemes or about the problem or about the concern, whoever is the care provider, she can be a nurse. So communication skills among nurses and rural health organizers and workers. They have knowledge. See what a beautiful point she's saying. They have knowledge, but often lack skills to communicate with women in a way that will help them to open up. So, friends, this is some part of the interview, and I will you can just see, you can, if you want to read the entire interview, you can just go and type this, what you need to know about women's health in rural India. You will be able to read the entire interview. So, friends, I hope today's topic is clear to all of you. We are just left with 1 minute, and as I told you, I'm very uncomfortable when the class gets abruptly end. Okay, so if you go according to the syllabus, which is there in your this particular book, I hope by now you have opened your material and you have seen it. So, in this, we have completed total of 12 units, right? So, today's discussion was basically about rural environment and urban environment and how it is connected with women's health. Please remember, every step can be instrumental to improve not only our environment but also health conditions. And I thank you all for joining me for today's class. And I will see you all tomorrow. And we are going to discuss in tomorrow's class major healthcare systems in India. So thank you all so much, friends. I thank the host of B.R. Ambedkar Open University. And I will see you all tomorrow at 8 p.m. Take care. Bye-bye. Keep smiling. Be happy. Be healthy.